नमस्ते दोस्तों, मास्टर्स, आत्मबंधन, आपका स्वागत है। आज हम एक्सेस कॉन्शियसनेस या बार्स के बारे में भी जानने वाले हैं। श्रीनिवास सर को आप सभी जानते हैं। सर इसरो में काम किए हैं और सर आईटी डिपार्टमेंट में भी एक बहुत उच्च स्तरीय आईटी कंपनी में भी काम कर चुके हैं। पिछली बार जब चंद्रयान ऑलमोस्ट लैंड ही हुआ था, तब उन्होंने पहली बार सेशन लिया था and he was very happy, and now he is taking, I think, the third session, and today he has agreed to speak to us about access consciousness. So he gave us so many tips and knowledge about acupressure. You can always go and look into the previous the sessions of his. And now I welcome Srinivas Rao sir from Bangalore to share his wisdom with us. Thank you, sir, for giving us your time, and welcome to this session. Thank you, sir.
Thank you. Thank you. As she said, I worked in ISRO for 13 years as a scientist, and in Hewlett Packard for 16 years, and as a senior program manager, and then I was India operations manager for about 5 years in HP itself, and then I received some MVP award in 2006. So I learned alternative therapies in when I was in ISRO in 1992. From Dr. Bojraj, and then afterwards several gurus came into the picture, and so Guru Vandanam. So I bow to all the gurus, including my spiritual guru, Mataji Krishna Priya, for this session, for arranging this. So while we wanted to uh, speak out or share our knowledge with others, unless the Guru Agnya is there, we will not be in a position to get the time, so right time. So I really feel blessed. Recently, last week I went, 2 weeks back, 22nd, I went to Pyramid Valley and had good meditation there. And then afterwards, I am seeing good presentations here. Thank you, Patriji. Too. Okay. So the alternative therapies I have been practicing as a life coach, career counselor, then acupressure, pranic healing, access consciousness, bachelor remedies. For bachelor remedies, we use for the emotional healing, and access consciousness also is for emotional healing or physical healing, psychological healing, so many things. And the color therapy, probably in the next 1 week, we'll cover color therapy also. Okay, so we'll move on. So this today's topic is about the access bars. So what is this access bars and access consciousness? So the next one, there are 32 points in the brain. I'm going to show you in the chart clearly. Then these 32 points, don't get confused with the acupressure points. There may be some collision or some mapping of these points or Varmam points, etc. But let us not club that technique with this technique. So this is there are 32 points where just by touching the points with the fingers very lightly, no pressure. We are not applying the pressure like in acupressure, just by touching the bars, like as you see in this picture here. So how he is touching here. Okay, so with that, there will be the energy flow that will happen in the body, and from one side of the head to the other side of the head, a pipe will be created. Okay, so in the pipe, the energy flow will happen. So that means in any blockages within the body, within the head, they will be removed, and then the pipe will be carved. That is something like a bar. So that's the reason the energy, the access bars have come to the picture here. Okay, so then. I got trained in access bars, and I was a facilitator. To become a facilitator from three different people, same course we have to do it. And then otherwise, if you do only from one trainer, we can do only the practice. We can be a practitioner. So I did the training, and then for 4 years, 5 years, I was doing the facilitation also. That means training others. Then I went through body processes. There are about 35, 36 body processes where we are, by on our body, we keep our hands, and then we chant the English mantras, English statements literally. So thereby there is a shift in the energy level that happens in the body. And then got trained in money class, and then foundation, level 1, etc. and all. So this is several classes are there, still they are going on. And yeah. Okay. What I would like to mention is access bars or any alternative therapies can be used along with any traditional medicine like allopathy, homeopathy, Ayurveda, or any other treatment of healing systems. Access bars will help increase the body healing capacity. So no side effects from here. It's because we are only touching the points here and not even pressing. So the pain also will not be there like we discussed in acupressure. This presentation is only for the education purpose only, and consult expert in the field before using it for the major ailments or any thing you want to do. However, I want to give few tips today as a carry from this meeting. Pregnant ladies, no harm in using treatment only by experts. So no harm, why I am saying here is because it is only the relaxation, ultimately the body relaxation. So pregnant ladies also will have a lot of tension and stress and lot of questions in their mind. So all the things will be answered when we are running the bars, access bars. Okay, so there is no harm in doing for that. Even the emergency, please consult family physician or medical system.
हाँ, इसको
The,
मैं हिंदी में बोल देती हूँ क्योंकि ये मतलब एक किस्म से
yeah, yeah,
इम्पोर्टेंट है।
yeah.
तो श्रीनिवास सर ये कह रहे हैं कि जो एक्सेस बार्स का जो ये सेशन अभी ले रहे हैं, ये सिर्फ आपके नॉलेज के लिए है, इंफॉर्मेशन के लिए है, आपके ज्ञान के लिए है। अगर आपके शरीर में कोई भौतिक शरीर में कोई बीमारी है या आप गर्भवती हैं, तो आप किसी एक्सपर्ट से सलाह लेकर ही ये करें। वैसे आमतौर पर आप ये एक्सेस बार जो उन्होंने समझाया कि सिर के ऊपर माथे पे कुछ पॉइंट्स होते हैं, उसको दबा के एक पाइप सी खुल जाती है, ये रिलैक्स करती है। तो कोई आप यूज भी कर सकते हैं, गर्भवती महिला भी यूज कर सकती है। कुछ होता नहीं है, पर अगर कोई उपचार करना हो, ट्रीटमेंट करना हो, तब आप एक्सपर्ट के पास जरूर जाएं। जी सर।
Yeah. So, yeah, so the access consciousness is a new age thought movement originated in US, California, and he is Gary Douglas at the top one. You can see here the Gary Douglas, who is the owner or creator of this access consciousness, and then he did it in around 1995, and he is Dain Heer. Okay, so Dr. Dain Heer. So both of them uh, अचानक से मिल गया एक बार, and then they started discussing. Then he was a chiropractor. Gary Douglas was a chiropractor, and उससे दोनों मिलके अभी करेंगे, ऐसा करेंगे बोल के जो शुरू किया, तो ऐसा ये हो गया, एक्सेस कॉन्शियसनेस हो गया है. Okay, so this is very simple and easy technique, and there are about 31,000 worldwide facilitators or practitioners are there, more than that actually, and in about 75 countries or 80 countries, people are practicing access bars. In India, about maybe 200 people are there. So when I learned in 2012 in India, there were only about 45 people. So afterwards, the more classes started happening. Both Gary Douglas and ये भी आया था, डेन हीर भी आया था बॉम्बे को, इंडिया को, दिल्ली को. So then the more number of people and the more number of facilitators are there here. And there is no harm in practicing by anybody, and no particular qualification required. A degree चाहिए, सब बस इंग्लिश एक थोड़ा इंग्लिश मैनेजेबल इंग्लिश आए तो ठीक है, उससे ज्यादा कुछ जरूरत नहीं है इसके लिए. कोई भी कर सकता है, बच्चा भी कर सकता है, स्टूडेंट्स भी कर सकते हैं, एंड या ओके. मैंने ऐसा बोला बताया था 32 पॉइंट्स ना, 32 पॉइंट्स है हर जगह में, बॉडी में या हेड में। वी टच इन द एक्सेस बार्स में खाली हेड को टच करते हैं, किसी पार्ट ऑफ द बॉडी को नहीं टच करते। एक बार इधर इधर टच करते हैं फिंगर्स का मिडिल में, और एक बार फीट में मिडिल ऑफ द फीट एक बार टच करते हैं। इससे बिना खाली द पेशेंट हैज टू लाई डाउन। We don't call patient, actually it is a client. Okay, anybody, even for I want to become, I want to relax, I can just lie down and then we can run the bars for me, because that is a good relaxation technique for us. Okay, so the कोई भी the 32 पॉइंट्स में दबाने की अब जरूरत भी नहीं, जस्ट टच करने का है। सो इधर एक इम्प्लांट बैंड बोल के दो पॉइंट्स है बीच में, सर का पीछे पीछे जब ये जॉइन होता है नेक और ब्रेन जॉइंट पॉइंट में एक पॉइंट होता है, ऐसा 3 फिंगर का आता है। उसमें 10 मिनट्स, 8 to 10 मिनट्स पकड़ के रखना है, टच करके रखना है। उसके बिना अब बाकी पूरा 2 मिनट्स और 3 मिनट्स होता है। इससे क्या होता है, वो जब पीछे का टच करते हैं, वो इम्प्लांट बैंड कर टच करते हैं, उससे पुराना वाला जो भी प्रॉब्लम्स अपने में है वो पूरा निकल जाएगा। इवन दे कॉल इट द पिछले जन्म का प्रॉब्लम्स जो भी है वो भी निकल जाएगा। ओके, सो वन caution is here, when we are doing access bars, or when you are doing access bars, don't wear any electronic items on your body, जैसा watch, smartphone, everything you have to keep it aside. क्योंकि there are incidents where electronic watches get damaged for 20-24 hours, afterwards they started working, but the energy level that is being produced by body, जो एनर्जी अपना बॉडी से जो आता है उसी से ये खराब होने का चांसेस है। बाहर से कोई आ रहा नहीं, अंदर में, अंदर के अपना बॉडी में जो एनर्जी ब्लॉकेजेस है, जब वो ब्लॉकेजेस निकलने के बाद जो एनर्जी सर्कुलेट होता है उसी से वॉच वगैरह खराब होने का चांसेस है। इसलिए वॉच और मोबाइल पास में नहीं रखना चाहिए। और अनदर caution, जब वी आर डूइंग इट, डोंट क्रॉस योर हैंड्स लाइक दिस, or don't cross legs. Okay, there are two parts in this. One is the physically doing, यानी ऐसा लेट के पकड़ना, पॉइंट्स पकड़ना, 32 पॉइंट्स पकड़ना। दूसरा ओरल, verbal, we ask questions, we chant certain things. Okay, so that I'm going to cover this as a takeaway for you, which anybody can do it. So that is one. The two parts is this, accessing to the consciousness, that means to get to the awareness. That is the reason they call it the access consciousness. And then the other points here, this is sadness, and this is a joy. Okay, soy and jadness. And here they are called the bars again, that anywhere in the point we can touch. And these points are uh, bridging the bar, when we are touching like this, all the 4 bars we are touching, so it is called the bridging the bar. Then this bar is the body, and this is the aging toaster. These two are called the aging toaster. Now अभी बोलते हैं अभी एज हो गया, इसके लिए उसका आंखों का प्रॉब्लम आ रहा है, डायबिटीज का प्रॉब्लम आ रहा है, इसका एज हो गया इसीलिए तो सुनाई नहीं देता, ये पूरा एजिंग रिलेटेड प्रॉब्लम्स बोलते हैं ना। सो द हड्डी कमजोर होना वगैरह, ऐसा कुछ नहीं है इसमें। जो भी है अपने आप का है, क्योंकि ये हेरिडिटरी भी नहीं है, ये एजिंग का भी नहीं है। जब वो वीक होता है, जब when we touch these points, aging toaster points, for 3 to 5 minutes, all aging related problems will be solved, hereditary related problems will be solved. Then sexuality, if there is any problem with the sexuality and body related, are run together, body and sexuality both. Iska, this point and this point we touch very lightly on this one. Okay, so this is what is the body and sexuality, aging toaster, एंड देन रीएक्टिवेशन से क्या होता है, कभी कभी एक ही सेशन में 40 मिनट्स 50 मिनट्स करने का टाइम नहीं मिलता है, और पेशेंट कोऑपरेशन नहीं होता है, क्लाइंट का कोऑपरेशन टाइम नहीं मिलता है उसके लिए भी। आफ्टर डूइंग सर्टेन फ्यू पॉइंट्स करने के बाद इसमें ये रीएक्टिवेशन एंड रिक्रिएशन पॉइंट टच करके छोड़ सकते हैं थोड़ा देर के लिए। ये क्योंकि रिएक्टिवेशन रिक्रिएशन व्हेन वी डू whatever the energy circulation happened till that point, वो टाइम तक जो भी एनर्जी सर्कुलेशन हो गया वो ऐसा ही रहेगा, उससे कम नहीं होगा। So next session on quicker recovery from diseases and injury, negation, better manual mental clarity, increased energy and stamina, changes in addictive behavior patterns। so अभी किसी का addiction है, उस ये करने से उसका addiction भी कम होता है, and changes in addictive behavior, reduction or elimination of the pain, peaceful and restful sleep। इंसोमिनिया बोलते हैं, रात में नींद नहीं आता है, 4 बजे 4 घंटे तक उठ के रहते हैं, नींद नहीं आया बोल के। सो ऑल दिस थिंग्स कैन बी अवॉइडेड विद दिस ट्रीटमेंट। रिसीविंग अबंडेंस विथ इज लेस रिएक्टिव देन द सिचुएशन। सो जब झगड़ा होता है, हम जब भी किसी बात को ही बोलते हैं, हमको इमीडिएट रिएक्शन होता है हमारा, और ऐसा रिएक्शन नहीं होगा, सो भी सोच समझ के आंसर देंगे। ये करने के बाद तो माइंड काम होता है, क्यों बोल रहा है ऐसा सोच के हम आंसर दे सकते हैं। Okay, so then I'll just stop this sharing. And age limit, there is no age limit. Children's to aged, all category of people can be done. Even special children with learning disability, milestone delay, etc. also can be done. So now इधर क्या होता है, what just anybody can do this one, there is no problem. But because we cannot really teach, we are not authorized to teach publicly like this unless it is a paid program by anybody. So I cannot give all the points here, but just some tips I will tell. Okay, so when we are having the back side of the point here, it comes like this. Okay, so easy way is where implant band, when you are just touching, you can switch on the videos and try to find out your points there. So that no, when uh, just move like this from the back, and 3 fingers, there will be some slit kind of a thing you will get, यानी ब्रेन में एक लाइन का जैसा आता है, दो ब्रेन का टुकड़ा उधर पीसी जॉइन होता है इधर, like that it is a gap will be there back, near the back of it. Okay, so you can try to get that points there. And how long you have to hold, when you get the point, just you can say that there is point that implant band, you are searching kidhar hai kidhar hai kidhar hai bolke, so you are asking the questions, and at some point you will get it, that automatically you will get it. That is the beauty of it, access consciousness में. So क्या होता है इधर, जब when we touch these points there, hold it for a few minutes till there is a pulse sensation. जब पल्स मिलता है उधर, थोड़ा देर के लिए आप पकड़ना चाहिए, वो टच करके रखना चाहिए उधर। So now I am getting it, 1 2 3 4. Then when you hold you have to make a statement of implant band run. That's all, only simple statement, implant band run, that's all. So automatically it will be running, that implant band will be running. So now, for instance, that can be run for 10 minutes, 5 to 10 minutes, 8 to 10 minutes we can run. क्योंकि अपने आप में वो पूर्व जन्म का भी होता है, प्रॉब्लम्स निक्षिप्त होता है उधर, और अभी इस जन्म का पिछले जो भी किया था वो प्रॉब्लम्स भी निक्षिप्त होता है। When they are, all these problems are stuck in our body, we are not really ourselves. So when we remove all these negative energies and this one, we can change our energy level. So you want to ask some question or tell something?
Yeah, sir. Sir, I personally have question.
Yeah,
So
please
when
tell
I
me.
touched, I can feel, मतलब मुझे वो जो ब्लड का चलने का होता है ना, वो समझ में आ रहा है अपनी उंगलियों में, है ना?
हम्म,
बोल रहे हैं, बता रहे हैं। तो अभी 1-2 मिनट भी रख लिया, लेकिन जब मैं वहां पर रख रही हूँ तो क्या उसका असर, कि जैसे मेरी ऐसा लग रहा है कि मेरी आंखों तक या मेरे पैरों तक इस तरह का कुछ ऐसा होता है क्या? क्योंकि एक्यूप्रेशर में भी मुझे कुछ ना कुछ लगा था कि
अभी
मेरे,
आपको क्या लगा है? अभी आपको
अभी
क्या
सर
लगा?
आंखों में ऐसे लगा कि यह आंखों तक टच हो गया है, जबकि मैं हाथ इधर रख रही
नींद आ जाता है।
हूँ। हाँ।
यू विल गेट स्लीप।
हाँ, अभी तो मैं बैठी हूँ
स्लीप
और मेरे को
इट्स।
अलर्ट होना है, मेरे को पता है। लेकिन मेरी आंखों में ऐसे हो रहा है,
या
ऐसे।
नींद आता है, इसलिए व्हेन वी टच दैट यू गेट टू स्नोर। आई स्नोर डेफिनेटली आफ्टर 10 minutes 15 minutes. What happened, I don't know. First 5 minutes only I will be awake. And particularly the people, those who are having a lot of the growth problems and all, we can happily do this one. Absolutely, the like special children, mileage, growth milestones, delay problems, anybody we can do. But only thing is, some people will have a lot of irritation. I tried for one boy of 25 years, 26 years. He never allowed me to touch his head. ओके, सो मैंने एक और एक बच्चा को किया था, उसको 22 टाइम्स से डे फिट्स आ रहा था। फिट्स मालूम है ना, हिंदी में क्या बोलते
हाँ
हैं
हाँ,
उसको? मूर्छा,
चक्कर आना, या
मूर्छा।
मतलब ऐसे मिर्गी का दौरा पड़ना, दौरा।
हाँ, हाँ, दौरा पड़ना, फिट्स आता है, ऐसा ऐसा होता है। पीपल विल ट्राई टू गिव दिस वन। वेरी ब्यूटीफुल, वेरी हैंडसम बॉय, वेरी स्लिम बॉय। एंड 16 years से उसको ये प्रॉब्लम शुरू हुआ, और ही confined to wheelchair or bed, that's all, not going to this one. So when they called me, of course I did multiple things to reduce it, but this is one of the main things which has calmed down his mind, access bars. So when we touch this not only one point here, there is something called the power band, the full we hold here like this. Are you able to see this?
यस यस, बिल्कुल पीछे।
Huh? Like this, सर का
हाँ
पीछे,
हाँ हाँ।
just okay. And that is a power band point. Okay, so power band run, power band run, power band run, 3 बार बोलो, वो अपने आप power band run होता रहता है। जब when you are feeling the, sorry, when you are feeling the pulsation there, you can continue for till the pulse stops. That is the indication of running. So first it will start pulsing. So when you are holding it more time, it will stop pulse. So that means वो प्रॉब्लम उधर के लिए, वो एनर्जी का वो पॉइंट स्टॉप करके दूसरा पॉइंट को जाना है। दैट इज द इंडिकेशन।
तो सर आपने बस क्वेश्चन आंसर्स ले रहे, तो एक और बस एक कि आपने एक चीज सेंटेंस बोला था कि व्हेन से सपोज टुडे आई हैव डन एंड नाउ द पल्स इज नो मोर एंड आई डिड इट एंड नाउ इट्स कंप्लीट आफ्टर 2-3 minutes। हाँ,
हाँ,
तो अब मैं कल दोबारा से करूंगी तो दोबारा से फिर पल्स मतलब देखना है, मतलब
क्या सेम थिंग, सेम थिंग,
सेम थिंग।
टेक्निक इज सेम थिंग टिल you have to start searching the point. Once you get the point, you can start feeling the pulse. और pulse जब आता है and energy is flowing happening, when it stops, the energy flow stops at that level. Okay, so
ओके,
when you start next time, next session, that is a different अलग का problem है।
अच्छा अच्छा।
ओके, सो जब मैं ये बॉय का बारे में बोल रहा था, उसको 22 टाइम्स पर डे फिट्स आ रहा था। आई टचड दिस पॉइंट्स, ऑल दिस पॉइंट्स, व्हाट एवर इज रिक्वायर्ड एक्सेस बार्स में। नेक्स्ट डे व्हेन आई वेंट एंड आस्क्ड कितने बार हुआ, 6। Till that time he was getting 20 to 25 times per day fits. In one session it has come down to 6, and that day, second day, I continued the treatment. And the third day, when they told, the frequency and intensity have reduced. यानी जितना जोर से आता है वो फिट्स आता है, वो जोर भी कम हुआ, और द फ्रीक्वेंसी यानी 1 घंटा में एक बार आने का, 4 घंटे में एक बार आना, ऐसा। अगर 22 से 22 मीन्स इट इज ऑलमोस्ट 1 per hour, समटाइम्स 3 to 4 times per hour he was getting. So that 6 times it has happened. So like this, no, when in a combination of that particular treatment person I treated with combination of access bars and batch flow remedies and pranic healing. All the three combination I used. But after 5 days or 6 days, it has reduced drastically. But there was an impact of Paurnima and Amavasya again on the that kind of people, those who do not have the energy resistance. So a slight increase was there for that. But afterwards, we could not continue the treatment for some reason or other. But that is very powerful and very effective. So one of my colleagues who was in ICU after paralytic stroke, I went to the hospital. When he shifted to the room, he was not sleeping at all. Throughout the day, he was not sleeping, talking, trying to talk, because the paralysis, again, those people know they want to express, but they cannot really fully express. Even wife was not understanding. I went to a hospital and just touched these points. Within 5 minutes, he fell asleep. 5 मिनट में सो गया वो, और उसको 4 घंटे के बाद
उठा वो।
नींद से बाहर आया था।
हम्म।
तो वाइफ फोन करके बोली थी मुझे, बहुत अच्छा किया आप आके, जो जो भी किया था, इट इज वेरी गुड, बिकॉज ही वाज नॉट हैविंग स्लीप फॉर लास्ट 3 days or 4 days. Okay, so the even for one of my uncles also I did in when he was in hospital, I did that. And on my inauguration day, so the this is basically the 32 points which are there, and we have covered all the points showing there. And each point you have to touch, and like this, there is various methods of touching are there. Okay, so now the examples I am telling, because where all situations we can use. Say there's a communication I told. In the communication problem, the two students, my son's friends came to my house, and one boy was having a stammering, and the other boy does the yoga, meditation, and still he has a speech fear problem. He cannot speak in front of the even 4 5 people also, he cannot speak. वो क्या हुआ, ये हमारा घर को आया तो इंजीनियरिंग 3rd year स्टूडेंट, जो उसको स्टैमरिंग हुआ था, हो रहा है, अकल ना, क्या बोलते हैं बात को, अकड़ना. So for
स्टैमरिंग हो
that
रहा है,
boy,
मतलब मतलब कि बोल नहीं पा रहे हैं, ठीक।
बोल नहीं पा रहा है.
हकलाना।
सो
हकलाना, हाँ
बोलने
सही
जो
बोला।
बोलता है बहुत धीरे से बोलता है, लेकिन
हकलाना।
बात करने के लिए थोड़ा शाई होता है उसके, क्योंकि ऐसा स्टैमरिंग होता रहता है, पूरा लोग से बात करना बोले तो स्पीड कम होना चाहिए वो लोगों का. So I did
अन्नपूर्णा
30
मैम बोल
minutes.
रहे हकलाना।
Haklana. So the 30 minutes for both the students I did. Both are in different colleges. The first boy who is having stammering, he sent me a mail within 2 3 days. Sir, uncle, we had a very typical situation in our college. He is a part of cultural activity, and then there is a chaos. यानी पूरा गड़बड़ चल रहा था स्टेज का ऊपर. कोई क्या बात कर रहा है, किसी को समझ में नहीं आ रहा. वो टाइम पे ये जाके उधर पूरा कंट्रोल कर दिया, और बहुत अच्छा बात किया था. वो लेटर भेजा था मुझे, तो खाली बिकॉज ऑफ ओनली डिफरेंस इज एक्सेस बस. 30 मिनट्स एक्सेस बार से उसको ऐसा हुआ. तो उसे धैर्य से जाके स्टेज का ऊपर बात करके पूरा लोगों को कंट्रोल किया था वो. So that is the courage he has got, and that is the way he is able to speak. And दूसरा boy, वो क्या हुआ, उसको विप्रो का विप्रो आर कम सम एमएनसी केम एंड कंडक्टेड एग्जाम कंडक्ट किया था. 500 स्टूडेंट्स में से कोई 10 स्टूडेंट्स सेलेक्ट हुआ रिटर्न टेस्ट के बाद, और 10 से 3 आदमी को स्टेज का ऊपर आने के लिए कहा था. ये तीनों आदमी में एक था ये बच्चा, और ये स्पीच देने के लिए बोले तो बिना डर डर से बात करना शुरू कर दिया, स्पीच दिया था. But she can identify, she cannot speak also, but she can identify in the mobile father's name, number, and she can send messages. So when they come for the fingerprint analysis they have taken, and they wanted to consult me for the thing, then we did the bars run. वो 4 बजे को सोई थी, नहीं हमारा बेटी ऐसा क्यों करते हैं, ऐसा नको बोल रही थी उसका मदर। हमने किया तो कि अपॉर्चुनिटी तो दो, अब सोती है नहीं बाद में नहीं, सोने का जरूरत नहीं है, लेकिन करेंगे। तो क्या वो जस्ट द टच करते ही, ऐसा पॉइंट्स कुछ टच करते ही शी स्लेप्ट फॉर 20 minutes. Okay, within the 20 minutes, afterwards, after 1 week, they sent a message. Her speech clarity has improved.
जी जी सर। सर कभी कभी ना कोई बच्चे जो होते हैं, बहुत छोटे बच्चे जिनके साथ हम बात नहीं कर सकते हैं, लाइक
Yeah.
3 मंथ 2 मंथ इवन न्यू बॉर्न बेबी, तो वो ना रात में रोने लगेंगे ऐसा। तो मतलब आपने बोला है कि एज इज नो बार, बट ऐसे में कोई पॉइंट को भी टच कर सकते हैं क्या, कि मतलब उसमें ऐसा टच नहीं करना चाहिए? आपका क्या राय है?
वो टच कर सकते हैं,
हाँ,
लेकिन वो जो मंथ्स का बेबी है ना, उसको
हाँ,
क्या प्रॉब्लम है हमें मालूम नहीं है।
हाँ,
उसको भी स्टमक में प्रॉब्लम हुए तो भी रो सकता है। उसके लिए पाँव में थोड़ा हल्का सा प्रेशर दब करे तो और रोना बंद कर देगा। वो आक्यूप्रेशर में जब बताया था हमने,
अच्छा
पाँव
अच्छा
में
पाँव।
करना है हमारा। हाँ, वो पाँव में करे तो हो जाता है। अभी एक आदमी आया ना, तो प्रणव बोल के आके चले गया था। उसका भी उसका सामने मैंने बोलना नहीं चाहता था सर, लेकिन वो बच्चा भी थोड़ा माइलस्टोन डिले है, थोड़ा मुश्किल है उसको, किसी से बात करना भी मुश्किल है उसको। लॉट ऑफ प्रॉब्लम्स ही हैड। जब भी मैं हैदराबाद जाता हूँ उसको बार्स करने के लिए 4 दिन मेरे पास ही रहता है वो। एंड द ट्रेमेंडस ग्रोथ वी हैव सीन उसी वो अभी आजकल लास्ट ईयर ऐसा बच्चा बीबीए एग्जाम में 31 पेपर्स ही हैज क्लियर्ड इन 1 ईयर। 31 पेपर्स। और he cleared
वंडरफुल।
LIC exam also. That is because regularly we were doing every year, twice I go to Hyderabad. Whenever I go 4 days he will be with me. क्या होता है बोले तो उसको बोलना को समझ बोल नहीं सकते वो, उसमें क्या हो रहा है, why you want access bars, he cannot tell why. But when we do this one, he feels very happy and calm down, and otherwise no very aggressive behavior and shouting, fighting and throwing everything. So that kind of a behavior was there. It has calmed down and now he is employable. He has come
राइट
to that stage.
राइट।
Okay, so then next one is like many people know, the one lady came to my clinic on the opening day. She was after doing 15 minutes on, because many people were there, I did only 15-minute sessions for the people. After getting up from the session she was doing like this. मैंने पूछा था क्या नमनेस आ गया क्या, हाथ में क्या हुआ? नहीं सर, मेरे को 4-5 साल से मुझे पेन था हैंड में, कुकर लिफ्ट करके बाद में रखने के लिए मुश्किल होता था। अभी तो वो पेन नहीं दिख रहा है, इसीलिए मैं वंडर हो रहा हूँ क्या हो रहा है बोल के।
वाह।
Only 15-minute session in one day, and afterwards for 2 months I followed up. Are you still getting it? Are you still getting it? She never got back that pain.
सर
So that is
आई
the
वांट
power of.
Sir, I want to ask some questions. Is this a good time, or you want to say?
Yeah, yeah, you can ask.
Okay. Sir, in the beginning you showed आपने दो लीडर्स जो एक्सेस बार्स जिन्होंने शुरू किया उसके बारे में बताया। फिर आपने ये
Mm,
भी बोला कि ये पॉइंट्स जो है वो एक्यूप्रेशर वाले पॉइंट से अलग हैं। आपने ये भी
mm.
बोला। तो फिर उन्होंने किस तरह से डिस्कवर किया, अगर आपने कुछ बताया, या मतलब उनको ये ज्ञान कहाँ से आया, या सिर्फ कुछ बताएं
तो
थोड़ा सा।
वो अभी हम भी कर सकते हो, हमको भी आया था ऐसा ही जो वो बताया था।
अच्छा अच्छा।
डगलस, कैरी डगलस। सो क्या बोलता है, जब आप पॉइंट्स को सर्च करते हैं, when you are sliding your fingers like this, at one point you will get the point. So then your finger movement will stop automatically at that place. For some जब स्ट्रक्चर थोड़ा अलग से रहता है ना किसी को, इधर हमको मालूम नहीं होता है, we cannot get the points easily. Okay, so when we are touching, when we pull our fingers like this, we pull like this, then at one point we feel that yeah, that is the point, and there it will start. So that is the beauty of this. Easily one can find out, but it needs a practice.
नहीं सर, प्रैक्टिस की
Okay,
बात तो
so
ठीक है, बट
yeah,
जैसे आपने बोला था कि एक्यूप्रेशर चाइना से आया, या हमारे ये जो नाड़ी का सिस्टम है वो हमारे पंचकोश में ये सारे पॉइंट्स होते हैं, ये एंशियंट
uh,
हिस्ट्री या एंशियंट आयुर्वेद या
mm.
एंशियंट सिस्टम से आया। तो ये एक्सेस बार्स तो अभी आपने बोला न्यू एज का सिस्टम है, तो उनका उसका कुछ बेसिस है क्या सर? ये एक्सेस बार्स का
Yeah,
कुछ
the basis बोले तो that is energy circulation. He was a chiropractor. Yani that bone setting वगैरह and that hair massage and all those things they will do. And for such a person, when he was doing something transformed for him, and actually I will come to the next slides. The questions are there. When we are in the question mode, all of you can practice that more easily to solve the personal problems. Okay. So I'll just quickly cover one or two cases, or maybe let me see what all I have covered so far. Okay, so then I was applying the knee oil for the knee pains at that time, and then 2 floors coming in the evening and climbing, getting the key for the first floor and all. I was getting irritated, and घर में the moment you come to home you start shouting. मैंने बोलता है मैं बेल प्रेस करे तो तुम आके की क्यों नहीं दे सकते? हमने सोचता है आके आप भी टीवी के सामने बैठते बोल के, ऐसा झगड़ा कुछ ना कुछ होते थे। So the key, the moment, the idea here is because I'm climbing 2 steps, 2 floors, I'm getting knee pain, and immediately fighting and all used to start. And night I used to apply the oil for this my knee pain and all. So one day when the realization where it happened, what happened is there is a statement particularly in the access bars which we are going to discuss about next 15 minutes about that. Okay, so there was a statement, who does it belong to? And till that time I never had pain for last 2 years. Uh, previous 2 years यानी 2010 तक नी पेन नहीं था मुझे, देन बाद में शुरू हुआ, देन हु डज इट बिलोंग, किसका होता है वो पेन? So the question is that POD POD POC, who does it belong to? POD who does it belong to? POD then I had one realization at that time. 2010 में हमारा 9 में हमारा मदर पास्ड अवे हो गया, 10 में फादर पास्ड अवे. So 9 में when मेरा फादर केम टू बैंगलोर, मेरे साथ लेके आया था उसको, डेली नाइट में ऑयल अप्लाई करता था मैं. सो द नी प्रॉब्लम एंड एंकल प्रॉब्लम ऑयल अप्लाई करके करता था. वो हमारे पूछते थे, अरे इतने रात हो गया, 10 बजे 11 बजे हो गए, जाके सो जाओ, अभी करने का जरूरत क्या है बोल के. लेकिन ही यूज टू लव दैट. ऑफ कोर्स आपका लव एंड अफेक्शन वी आर टचिंग एंड देन डूइंग इट ऑल द थिंग्स, but somewhere in my mind I used to do to my father and he used to enjoy it, his pain was reducing. That was there in my mind, and I was carrying forward that statements. Okay, whenever I apply my oil for my this one, I used to remember my father. So that means that connection became so deep that I am carrying the pains. When I did the access bars and when I realized it, that is, I cut that statement that podpoc is point of destruction, point of creation. यानी कहाँ वो थॉट आता है, कहाँ वो प्रॉब्लम शुरू होता है, हम कट करके भेज देता है. इट स्टार्ट्स क्लियरिंग मिलियंस ऑफ पीपल्स problems. That's what they say. Okay, so that is the one, and immediately within 2 weeks after my access bars class, the pain has vanished for me. Till today I never had any this one knee pain. Okay, so that is the power of access bars, and the statements are much more powerful. I will tell you that statements now. Okay, so when I did for the family doctor also, uh, 1 year migraine, yeah. Migraine, one person used to take daily some 4 tablets in the early hours, morning and all. 12 sessions we did for him. माइग्रेन कम हो गया, उसका टैबलेट्स लेना बंद कर दिया. एंड नेक पेन रिड्यूस, ग्रोथ रिटार्डेड चिल्ड्रन जैसा मैंने बताया था वो किया था उसको. एंड 3-4 पीपल द ग्रोथ रिलेटेड चिल्ड्रन, एडीडी एडीएचडी बोलते हैं, ऐसा लोगों को किया था. बहुत अच्छा ये हुआ. और हमारा इनाग्रेशन का, क्लिनिक इनाग्रेशन का टाइम पे हमारा फैमिली डॉक्टर को भी बुलाया था, वो भी आके करके, अरे 15 मिनट कैसा चले गया पता ही नहीं। उसना बस का तो मेन रोड का ऊपर है हमारा क्लिनिक, बसेस के कितना जाता है, वो 11 बजे के टाइम पे पीक आवर बसेस है। उतना साउंड में भी उसको गहरा नींद आ गया। And 15 minutes treatment and 3 hours sleep by one friend. Okay, and then yeah, somebody had this 40 lakhs debt. किसी को दिया था, और बहुत daily he was getting anger, and after this session of this one, mind has calmed down and his behavior has changed. His the for each and every small incident, small talk also, he used to get lot of. Okay, yesterday I was suggesting to somebody, yeah, that madam has come, Shantala madam. Welcome, Shantala madam. So when throat pain is there, so our hyperthyroid or thyroid, when we have that problem or anything, any problem related to the throat, cough, cold, or anything, just to hold your this one, start repeating that demolecular manifestation. Touch the palm point, should touch that area. Okay, so molecular are like this also you can hold molecular demolecular manifestation. It doesn't matter whether what you say first and what you say second, because when you are telling continuously, the mantra automatically will happen. Demolecular manifestation, molecular demanifestation, demolecular manifestation, molecular demanifestation, demolecular manifestation, molecular demanifestation. Just repeat that for 10 to 15 times with awareness. Just close your eyes and then put that and think that with this mantra I am changing my own body cells, and you see the wonderful results. Okay, so and suppose there is a heel pain, there is a knee pain, because the cells which are accumulated cells are whatever the cells that are formed and staying today at this point in time, they will change and a new cells will come with the freshness, and with they will not carry the old pain. I think all of you know, as energy healers, or maybe our old cells will carry the memory of the previous cells, and the cells almost from few cells die in 10 days and few die in 120 days. In 120 to 150 days, all the cells in our body will change. So with this, actually, when the new cells are formed in the body, they carry old cells memory, and that's why the pain is continuing at that point in at that place, and that this one. Okay, so this can be used for, suppose there is a swelling at some place, you can just put your hand and demolecular manifestation, molecular demanifestation, and put it on your teacup or water, and then do the test the taste of that. You will change, you will see the difference in this one. So anybody can do, any age, there is no problem, absolutely. To change the cellular level, we can use this mantra. This, what else is possible? You are in a situation today, you are able to get good food, or rather the tasty food you buy from outside. What else is possible? Some other thing will come to you. In any situation, whatever good situation, bad situation, or unknown situation, doubtful situation, you can use these three statements. Suppose if somebody's health is not good in the house, and you are not able to get the proper treatment, not even proper diagnosis is happening, our spouse, our children, something. What else is possible? What else is possible? What else is possible? Just keep chanting sometime. Some possibility will come from the universe. Okay. How does it get any better than this? Suppose somebody is ill, and when you are chanting this, how does it get any better than this? Some proper treatment will happen. So be in a question mode and keep asking these three statements on a daily basis, and it will give you a lot of change in your life. And another important question I will tell you, uh, who does it belong to, and POD POC. POD POC means it is point of destruction, point of creation. Actually, it comes here in this one. POD is the point of creation of thoughts, feelings, emotions, immediately preceding whatever you decide. And POD is point of destruction, immediately following whatever you decide. It will like pulling bottom of cards for the house card and all something. So the short form is PODPOC, and it has become the, in the access community, the PODPOC has become, I PODPOCed it today, I WhatsApped it today, I left it today, like whatever they call it now with WhatsApp statements. So this has become very common. I PODPOCed it. So if there is a cough and cold, who does it belong to? Suddenly some stray thought comes up, some death thoughts comes, some irritation thought comes, which normally we don't think of. So that time, who does it belong to? Podpoc, podpoc, you can do that. And my pain, knee pain, I said I was using podpoc statement. So this kind of a things, no, we can use it. So this is with a lot of their work. Okay, and you can just practice these statements every day, something different. Ask what difference I can be today, what is right about my situation. I am not getting it. 5 6 times we can repeat. Suppose if we are in a tough situation or whatever happy situation, what is the right about my situation? I am not getting it today. 5 6 times you do it, you will get the answers for this one. Okay, so interesting point of view that you have this point of view. This is another important statement, where when you are was not there earlier, later they had it. Right and wrong, good and bad, pod and pock, online shops, boys and beyond. Each word has a different meaning, and uh, they carry a lot of energy. They carry a lot of energy. In fact, in a traffic situation, when I used to drive 2 hours almost daily, it used to take in the morning to reach office for the driving. I used to get in the traffic signals, the right and wrong, what else is possible, what else is possible. Suddenly, 5 signals will be cleared for me with
Or does not spiritually inclined or can also use all these techniques, na?
everybody can use this techniques.
Okay, sir. Okay, thank you. Thank you. That
Yeah,
one
this
was
is
very
actually the this is you are asking the question, and you don't try to look for the answers. Okay, so suppose if somebody wants to have a good environment, how does it get any better than this? How does it get any better than this? Just keep asking. You don't define what is good for you and what is good environment. It should be like this, it should be like this. Don't do that. So universe knows what is right for you, and they
surrender
will
to
try
the
to give.
universe. Surrender to the universe and accept it.
Yeah, put the questions to universe, and the universe will give you things. Say when I was in this question mode, there was, and people call, even I read the book called the ADD ADHD, the mm, pragmatic psychotherapy, psychology, pragmatic psychology. ADD ADHD, and these are all the uh, they brand the children based on because they cannot solve all the problems. But here what they say, it's a differently abled. When you are running the bars for that, you get to know more and more opportunities what the child is going through. And really you cannot believe it. I was treating one person, uh, 16-year-old boy who cannot talk. Only few words he can talk, but tongue twisting is not possible. He has been spastic since age of 6 months, and then several doctors have seen him. And last time on acupressure, I was telling that he cannot bring his hands like this. So I did this one zone therapy, and after few sessions, his hands have become normal. For him, regularly zone therapy and access bars I used to do, and I used to train him on something else. The tremendous potential. One questionnaire I give, I never expected that he will solve that questions. He solved, not only solved, whatever the English I am talking to you like this, I was speaking to him. And now I don't know how he was understanding my language. He is a Konkani guy somewhere near this one. He will understand. And he used to respond to my things and act. And then he was doing it. So that is the miracle that access bars or acupressure or bachelor remedies, all these things are carrying. That's what I just, my campaign here is, the systems are excellent systems. They work with all the alternative therapies or all the rather regular therapies, no side effects. Things will change for the people, whether it is a person having a physical problem, psychological problem, or no problem at all. If there is no problem, happily one sleeps 3 hours, 4 hours, a good rest, they will get it. So this is what I just wanted to, I'm happy that I got this platform. Thanks to Anuradha ji for giving me this opportunity. And thanks to all the participants,
Thank
Madhulini
you.
ji and
Thank you.
Prasad. Annapurna and Shantalaji. So any doubts, any personal doubts you have, you can ask me. And particularly, suppose if the health of a person, family member is not good, you can repeat